Hi everyone. Welcome to today's session, Giovanni's Autism Center for First Responders and Autism. You guys hear me okay?
I got you.
Yeah, okay. And I overheard your name is Renee.
That's right.
Thank you. You came in person. I really appreciate it.
No, glad to be here. Thank you for having us.
I'm glad. Wanted to introduce myself a little bit. My name is John Ginsburg. I work for Giovanni's Quality Assurance Department, and Quality Assurance Department and myself are responsible for overseeing, managing, and investigating all incidents that occur within Giovanni and any kind of allegations that come in of abuse and neglect. We work closely with New York State oversight agencies such as OPWDD, OMH, and OCFS, which is the Office of Children and Family Services. Give you a little bit of my background. I retired from the police department. Spent 24 years in the police department doing investigations as well, obviously. Have extensive knowledge of investigations involving people with special needs. Once I retired from the police department, I spent a number of years working for the New York State Justice Center, which is a New York State agency investigating abuse and neglect. So if any of you have any questions, any concerns, anything you'd like to know, if anything I could help you with, you can call Giovanni's main number, and my extension is 1234. If there's anything I can help you with, it's an easy extension to remember. First, I'd like to introduce you to Kristin Kiggins, which is a behavioral specialist. It's coming up. Anyway, thank you.
Hi, good evening. I'm Kristin Kiggins, one of Giovanni's senior behavior specialists. I work with our individuals within our residence and our day programs, gearing towards more positive approaches with dealing with challenging behaviors. And I'm here to talk about how we can improve our communication with first responders in the community when it comes to our individuals who are diagnosed with autism. So when we're talking about first responders, we're talking about individuals who are law enforcement officers, paramedics, EMTs, firefighters. These are the people who are the first to arrive and provide assistance at the scene of an emergency. However, this presentation is not just geared towards our first responders, but individuals in our community, our service providers who work at the mall, at shops, at stores, where you might see somebody with a diagnosis of autism experiencing some sort of distress, and you could possibly be the first approach to being able to help them before first responders can come on board and take action. So when we're talking about autism, we're talking about a developmental disorder that affects communication and behavior. Individuals with autism have deficits with social skills, communication skills, sensory issues, and repetitive or restrictive behaviors and interests. Individuals with autism are typically diagnosed before the age of 3 years old. Some of the deficits that we see with individuals with autism when it comes to social skills is being able to have reciprocal communication, engaging in communication with others, eye contact, other areas where they might be verbal or nonverbal. Their language abilities vary drastically with individuals with autism, and they may have some cognitive deficits as well. If you think of our sensory processing, you may have experienced where you're in a room that's too bright, or your clothes are itching your skin, or it's too loud. These are some of the situations that people with autism deal with on a daily basis. They have either very high sensitivity to stimulation or very low sensitivity to stimulation and need to make up for that. We're going to get into more of some of the behaviors and key characteristics we'll see to be able to know if this is someone who has autism who is in distress out in the community. We also know that autism affects 4 times more boys than it does girls. And in 2020, the CDC said that autism is diagnosed 1 in 54 individuals. This is a drastic increase that we've seen over the years, so it's really important that we discuss this now, because there's more situations where there may be an individual with autism who's in distress in the community. So what does autism look like? I talked about some of the characteristics, and we'll mention more later on, but what does it look like? And what's really important is that if you take a quick glance at somebody, you're not going to be able to know if they have autism. There is no physical characteristics or traits to identify someone with autism. They look just like everybody else. When you see somebody in the community, it's not looking at them or looking at a picture of them, but when you start to see more of the behaviors and make an assessment of what you're seeing, that's when you may be able to tell that that person might have a diagnosis of autism. It's also really important to know that individuals with autism may be the victim or the suspect in crimes. It's important to weigh both of those out and to know that they can fit into either one of the categories, because typically individuals with developmental disabilities tend to be the victims of crimes. When you see where they might be the suspect, it may be a miscommunication or a behavioral situation that they're having difficulty controlling, but not to be violent. You may see verbal aggression, physical aggression, but there's some reason behind the behavior. They are not acting out maliciously towards others. It's also important to know that individuals with autism, yes, they look just like everybody else, and they also have a wide range of abilities. You may run into somebody who has autism who is driving a car, who works at your job with you. They look just like us, they are just like us, but the way that they process information may be very different than the way we process information. Okay, so what's some information for first responders? On a daily basis, first responders may encounter a multitude of emergency situations. And as first responders know, each situation differs from one to the next. That is very similar with individuals with autism. Just because you've encountered one person with autism does not mean you've met them all. They all have very different abilities, strengths and weaknesses, and it's important to never judge one based on someone you've previously met. There used to be a diagnosis of Asperger's in the DSM-5 diagnostic criteria, where it was individuals who were high functioning but were also autistic as well. Now with autism spectrum disorder, they are included. So you're talking about people who may be nonverbal and have severe behaviors, or individuals who can drive a car, communicate for themselves, have friends and families. So there's a lot of in between that, so it's important to know the spectrum of autism. First responders are trained to respond to a crisis situation with a certain protocol. However, this protocol may not always be appropriate or the best to interact with individuals with autism. It's critical that officers have a knowledge of autism and the wide range of behaviors so that they can best work with the emergency situation at hand. Teaching first responders the signs of autism is an important step forward toward preventing unfortunate situations. So if you are a first responder, there's some information on how you should interact with a person with autism. First and foremost, be patient and give them personal space. Individuals with autism may have difficulty understanding boundaries and not like being invaded into their own personal bubble. We need to be patient and give them the time to process information. When speaking and collecting information or just having a conversation, you want to use simple and concrete sentences. Using sentences that are too wordy or include too many steps may confuse, overwhelm, and frustrate an individual with autism. Because autism has deficits in processing, we want to make sure that we're giving them enough time to process the information that's being provided. If you don't get an answer right away, it's not that they're not listening or ignoring you. They may need a couple of extra seconds or minutes to process the information or the request that's being asked of them. We want to be alert of signs of frustration and agitation that might be possible to prevent situations from escalating. So if you see an individual and you're having a conversation, whether you're the first on the scene and you see that they begin to pace or engage in self-injurious behavior, hand flapping, things like that, that wasn't going on when you first arrived, you can tell that the individual is getting maybe more frightened, anxious, scared, things like that. So we want to make sure that we're doing our due diligence to de-escalate situations, not create higher stress for the individual. Avoiding quick movements and loud noises. We talked about how there are sensory issues when it comes to autism. So we don't want to make quick movements and loud noises that may overstimulate their sensory input. We want to be calm and move carefully when working with them to show that we are somebody that they can trust and it's something that they can expect, and not be more frightened of the situation. With crisis situations, there may be times when you need to touch an individual, whether it's providing first aid, CPR, physical restraints to secure their safety in a situation if they're in an unsafe area. To the best of your ability, do not touch a person with autism, as it may provoke them to being upset or agitated. Touch is one of the sensory stimulations that we see with individuals with autism that may actually hurt to the touch, or they don't like the pressure of touch. So if as much as possible, do not touch the person unless it's absolutely necessary or you're giving them warning before you do so. If the individual is with a caregiver, whether it is a family member, a service provider, community rehabilitation provider, you want to gain as much information as you can from that person. The more information you have about the individual, the more successful you'll be in helping them in the situation and to de-escalate the behavior. Is everyone still following along? I know I'm saying a lot.
No.
Okay. All right, we're going to move along then. So some more things to note about a person with autism, what they might have, common characteristics that we do see. They may have an impaired sense of danger. They may not be aware that running through a parking lot or running next to a street where cars are moving is a dangerous situation. Individuals with autism are very smart and very bright, but they may not sense that danger or understand how to prevent being in a situation that might be more risky for them. Wandering into bodies of water, traffic, or other dangers. We're going to talk about bodies of water a lot in this presentation. One of the ritualistic behaviors or hobbies that individuals with autism have is playing with water. Water play is very, very big, whether it's the faucet in the sink, the shower, the toilet being flushed, or pools, things like that. So we want to make sure that they're not going towards bodies of water that may be dangerous. Maybe they don't know how to swim and don't understand the depth of the water or their ability to get out of the situation. But that need and that desire to engage in that is so strong that they may not be aware. Being overwhelmed by police presence. Unfortunately, there's a lot of individuals who've had bad experiences with police for the lack of knowledge that the police departments may have had about working with people with autism and not understanding, which is the whole point of us having this presentation. How can we do our jobs more effectively? So if the individual becomes agitated with the presence of police, it's very possible they had a past experience that was negative. So it's important to know that and to take caution or approach with caution to make sure that we're not sparking any past traumas that they may have experienced. This can either go one or two ways. There might also be the fear of the person in uniform, like I was just speaking about with past experiences, or a genuine curiosity, liking things that are shiny, liking fire trucks and ambulances. It's very common with autism too to enjoy those interests and hobbies. So they may actually seek out in interacting with individuals who are wearing a uniform. So it's important to know that there may be some fear and there might be some excitement and curiosity. So if an individual with autism is approaching someone in a uniform, it might be just to look at their uniform, what they're wearing, the badge, the shininess of it. They're not coming to provoke or to engage in any negative behavior, but they're interested and they're excited. So it's important to know that too, that if you're being approached by somebody who may have autism, that it might just be genuine curiosity and to err on the side of caution just to make sure that it's not, maladaptive. That's not the intent of what they're doing. Fight or flight. Some individuals may freeze, some individuals may run. So elopement and wandering is a very big behavior we do see, whether it's with first responders coming, family members, everyday providers. There might be some flight risk that's going on there. Due to some of the communication deficits and social skills, they may not respond to the word stop or other commands, come here, things like that. It's not that they are not listening, it's just that that's not something that is gaining their attention. They may be avoiding or escaping the responsibility and that interaction with someone else because there's some social deficits there as well. So we need to find other ways to communicate. If they don't respond to his or her name or verbal commands, just kind of like I said, it may not be that they're ignoring you, but that's something that they typically don't respond to. Okay. Okay. So we've tackled a lot of these characteristics, but I'm just going to kind of go over them again. There might be that delayed speech and those language skills. You know, they may be able to speak in 1 or 2 answers, short sentences. Some may rely on picture cards, which is something that we're going to talk about later too for families. You know, identifiable images that they can relate to communicate their needs and their wants. They may avoid eye contact, engaging in repetitive behavior, rocking, hand flapping, spinning. This is what we call STEM behavior, and what the point of when individuals do that, they're either very excited or they're trying to calm down. So it's how they self-soothe in an outwardly way. They can't internalize it. They need to get that motion and that energy out of their systems. They may mimic phrases or behaviors. They may not know how to interact with others, so they're trying to pick up on what other people are saying and engaging in that as well to initiate conversation or have that relationship. They might not understand sarcasm or figures of speech. So we talk about those language deficits. Individuals with autism may not have a filter. They communicate just the things that pop into their head. So if you know, you ask if your outfit makes you look bad, they may say yes, not to hurt your feelings. They don't understand that social emotional connection. They are genuinely answering your question. So sarcasm might not be a communication technique you would want to use for not being able to understand the meaning behind what is being said. Personal space. As much as we don't want to enter their personal space, sometimes they need more assistance in understanding our personal space and our boundaries as well. So it's really important that we teach and model these behaviors so that they do understand these social cues that don't come as naturally to them as it does to us. They may have epilepsy or seizure disorders, and they might hide in small, tight places. Okay, this is really important when we're talking about emergencies such as fires in the home. I'm going to go into that a little bit more detail on one of the next slides, but it's important to know that hiding, that game-like or childlike behavior is something that's also very common with individuals with autism. So for first responders, we want to rely on the first responders checklist. We want to maintain a sense of urgency when searching for a person who's missing who may have autism. We want to make sure that we locate them as soon as possible, especially if there is those language deficits. We want to look for bodies of water. We want to assess the situation to make sure that it doesn't increase in the severity of what's actually happening. We want to communicate. We want to speak to the providers, the caregivers, learn about likes and dislikes and places the person with autism may like to seek out or to avoid. Determine their communication needs. It's important to know if the individual is verbal, nonverbal, the extent of their verbal communication, and how you can have that conversation and gain information back and forth with the individual. Search. Always search water first, all nearby bodies of water, pools, ponds, rivers, etc. We want to warn. Warn the person that you're going to touch them before doing so and allow them time to process information. We want to communicate what we are doing so they understand to the best of their ability of what's going on around them and how we're interacting them and trying to keep them safe. Avoid interrupting repetitive behaviors. I talked about how it's soothing for them. If they're engaging in a repetitive behavior and it's not a threat to their safety, let them finish their behavior so that they can calm down. okay? But if it's a self-injurious behavior of hitting their head or hitting themselves or another person, we do want to cease those behaviors for their safety and the safety of others around them. Avoid using lights and sirens. As I mentioned, sensory, huge with autism. The lights and sirens that may be on the fire trucks or the ambulance or the police car, it may distract the individual. It may scare them. And also we talked about seizures and epilepsy. They may have another disorder that might be affected by the lights and sirens as well. So we want to minimize that as much as possible. Be calm, be patient, and give lots of praise and encouragement. We want to continue to improve and strengthen their personal strengths. So if they're able to stop in a repetitive behavior, we want to appraise them. If they give us information, we want to praise them, encourage them, because it's only going to help continue their journey and their abilities for the rest of their lives. Typical calls that we see for first responder situations with individuals with autism: wandering and elopement. They may wander and not be able to communicate where they are going or how to return home. We've seen that a lot in the news, unfortunately, with missing people who are nonverbal. It may be while they're with a group of people in the mall, with family, running from home, but it's that fight or flight response that they have and may not be able to know how to undo the wandering or the elopement that they initially caused. Pain and injury. There are individuals with autism who have a very high pain tolerance or may not be able to identify and communicate the pain that they're actually in. So one of the first things we want to rule out with behaviors in autism is there a medical situation or a medical issue happening first? Once we can rule out any medical issues, we can look into other functions of behaviors. Is there something that they're trying to seek, something they're trying to gain, attention, tangible things? But medical issues is the first thing we want to rule out to make sure that they are safe. And last, emotional responses. Individuals with autism struggle with stress, anxiety, anger, and frustration. There is a very high comorbidity of individuals with autism, as well as depression, anxiety, bipolar. So not only are they dealing with a developmental disability, but there's a lot of mental or psychological diagnoses also happening concurrently. Okay, so they may have emotional responses and not have effective coping tools yet to help de-escalate situations. Some quick tips. Nearly 50% of individuals with autism of all ages are at risk for wandering from safety. Drowning incidents actually account for 91% of deaths in children with autism subsequent to wandering during search and rescue. So always search water first. Nearly 1/3 of people with autism are nonverbal. And people with autism may have difficulties communicating when stressed, confused, or afraid. So de-escalating the situation actually will save a lot more time to know how to help them best. If we can de-escalate the behaviors, we can gain more information to help treat them as best as we can, whether it's going to the hospital, returning home, whatever issue might be coming up. What to do? Wandering and bolting might occur. We talked about elopement. They may be standing still 1 minute and then just take off running the next minute. So we want to make sure that we're at arm's reach. We're giving them personal space, but we're also close enough to keep them from any danger as well. If there's a call to a home, we want to make sure that we're checking all hiding spots. Ask the family if available, where do they usually hide in the house? They may be afraid of the smoke, the fire alarms going off, or just the fear of the fire itself. So you want to make sure that they're not trying to seek cover somewhere in a hiding spot that's actually making it more difficult to pull them out into safety. We always want to provide reassurance and comfort to the individual. And if they are in immediate danger, we want to move them away from areas of high traffic, safety concerns. If they're outside and near a street, we want to bring them maybe inside so there's less of a chance for that bolting behavior. We want to keep them as safe as possible. So when we talked about not touching an individual with autism, there are situations where we need to ensure their safety first. If there's any immediate danger, we need to bring them away from the danger and then assess the situation further. So what to do if they are not in immediate danger, we want to establish the individual's communication. Ask questions. If they're not giving you a verbal response, they are listening, but they may not be able to reciprocate their responses to you. We need to find alternative ways to communicate. Use a calm, clear voice. Use 1 to 2 directives. Sit down, come here. We don't want to overload them with information. Explain what you are going to do as you're doing it. Make sure that they know exactly what your intentions are. If you're bandaging a wound, you want to let them know step by step what you're doing so they are aware of the process and there's no surprises for them. Avoid physical contact if possible. Avoid quick movements, move slowly. We're providing that personal space. Avoid too many people at the scene. It can become very crowded and very overwhelming, so it's really important that there's one point of contact person with the individual. All other responders should take a step back and give them room and space so they don't feel overwhelmed and crowded. Avoid loud noises, such as sirens, shouting, and may scare them. And if restraints are needed, it's important to know that some may have poorly developed trunk areas, so they may need to be changed in positions. They should never be laid face down. And even if they are being restrained on a gurney, but for a medical reason, they will resist and resist and resist, not realizing the restraint is actually to keep them more safe. So don't be surprised if you see that behavior, that texture or that restriction and that pressure might be too much for them to bear and not really be aware of we're trying to help the situation, not further put them in any harm's way. So general training guidelines, what does this mean for first responders? First responder agencies should always act proactively and train for their workforce, especially trainers, patrol supervisors, and school resource officers. Like we said, there's 1 in 54 individuals diagnosed with autism. It is everywhere and anywhere, so we want to be as informed as possible so we know how to deal with encounters that we may experience. Knowing the behavioral symptoms and characteristics will help make us have more improvements in the way that we assist others in the community. So we talked a lot about the first responders, but now we want to talk a little bit more about the families and how can we get families involved. We want to encourage families to have and obtain personal identification cards for their loved ones with autism. A non-driver's ID from the DMV, having their name and a picture is the best way to go, especially if they are nonverbal and wander. We can relocate them and get them home as safely as possible. So it's really important to have that identification on them. To-go packets with information that is pertinent about the individual. This can either be with the caregiver, with the family member, in their backpack, or in their pocket. But having to-go packets is important because if they ever do find themselves in a crisis situation or end up at the hospital, all of the information that they may not be aware of or be able to communicate is immediately provided to the providers. So this would include their name, date of birth, address, their insurance information, what their diagnoses may be, their language spoken, whether it's English or another language, their communication preferences, if they're authorized to give consent or not, and if not, who is the guardian, who is the parent or the advocate. Do they have any advance directives like DNRs? What is their diet consistency? They may not be eating at the hospital because it's not the right diet consistency or be a choking hazard, so we want to make sure that we're not preventing any other issues add to the situation. Allergies, whether it's food or medications. What medications do they currently take? Psychotropics and medical conditions. Healthcare providers, what's their medical history? They have any immunizations, and any other information that you think would be really important and that you would relate to their doctors if you were with them. Also, something that can definitely help deal with situations when we're in a crisis beforehand, having a proactive approach, is introduce them to their local first responders, whether it's law enforcement, EMTs, fire department. Get them familiar with the individuals who might need to help them one day. Get them comfortable around individuals with uniform so that we can de-escalate situations before they even occur. Practice fire drills at home. Every home should have a fire drill plan, whether it's with the family, whether it's a group home, so that in the event of an emergency situation, we're preventing hiding behaviors from happening, and we have a meeting point outside of the house. We know the routes that we're going to take, and we do it over and over again, just like we did in the school system. Educate the individual on their wants and needs in universal terms. A lot of individuals who don't speak verbal communication will either use their own version of sign language or their own version of gestures. We want to educate them in using universal approaches that other individuals may understand, whether it's sign language, pet cards, those picture cards I mentioned, communication devices, or key phrases. If the individual is prone to wander, utilize tracing devices. Shoes, there are many different articles of clothing that have tracing devices, like shoes, anklets, phone applications, anything that you can do if you know that that's a typical behavior of your loved one, that in the event that they do go missing, we have something in place that's all ready to help us find them as soon as possible. And working with providers, providers in your community, whether it's behavior specialists, speech therapists, behavioral response teams, get people involved so we can minimize these behaviors as much as possible. Interventions in hospitals. Unfortunately, with our developmentally disabled community and working with hospitals, there's been some conflict. A lot of hospitals don't necessarily understand the comorbidity of mental illness and developmental disabilities. We've had many people who've been brought to the hospital for behavioral concerns, and as soon as they get to the hospital, the behavior stops and they send them right back out, but they're still dealing with that behavior, just maybe not at that brief moment that they're being evaluated. So if your loved one is going to the hospital, if you can be in person to support and advocate for them, that is the best approach, okay? We want to make sure that they're being treated and assessed for everything as much as possible, whether it's requesting a behavioral case management review, additional medical evaluations, requesting an in-person psychiatrist evaluation, and we also want to advocate for less isolation. If someone with autism is coming into the emergency room, they may place them in an isolation pod because of their behaviors of self-injurious behaviors or physical aggression. The isolation pod can actually increase those behaviors. So if we can advocate for them to not be placed in those as much as possible, that would be only to assist and aid the individual. And that's all I have. I'm going to now introduce Jane Mullin, a licensed clinical social worker, to go over more of the resources that the community can utilize in the event of a crisis situation.
I thought John was next.
Jane?
You're welcome. I can take this off. Hello, everyone. Yes, I am Jane Mullin. How do you advance this? Because she knows. You don't want to look at my face. I love looking at your face, but I wasn't sure which one to use. All right. So this evening we are talking, as Kristin has so thoroughly discussed, how to help persons who work in the community with people with autism. And aside from first responders such as the police, the fire, ambulance corps, we have other first responders in our community who probably don't even know they're first responders. You might be the librarian at your local library. You might be the person at Starbucks giving out the coffee. There are lots of first responders in our community, but for tonight's presentation, what I'd like to talk about, aside from what's on the slides and the referral sources, I'd like to talk about the opportunity for first responders of any ilk, from police and fire to community-based people, to know that there are resources out there for you that you can reach out to if you yourself want more information on how to address a particular issue. So a person, as Kristin has discussed earlier, a person with developmental disabilities such as autism are eligible for home and community-based services waiver. That's a service that's provided to adults and children to access services that they would need to enhance their ability to live in the community at their best. They are people, both children and adults, young adults, elderly, anyone who has a developmental disability, including autism. They have have a great opportunity to access services from residential to day programs to work supports and a variety of other things. The reason I think it's important for first responders to know this is because sometimes a parent will say, or a caregiver will say, what do I do now? Where do I go? How do I get help? For a first responder to have an answer or an opportunity to find out what that answer is, I think is something that's in your toolbox in case you yourself want to be able to provide that or know where to send them to get that information. I think one of the most important things that parents and caregivers want to know is that their loved one is safe in the community. And we all rely on our first responders, whether we are a parent of a child with special need, if we are the daughter or son of an elderly person, and across the board. We want to be confident that our special needs individuals have access to the care and the support that they're going to need in an environment that's comforting and yet safe. So there are ways of getting care management services for adults and children with special needs, both in the OPWDD world, who for many of you I think are in that section. And we do have a mom in the audience, and if you don't mind, are you familiar with the OPWDD system?
Yes.
The other system that parallels that is the Office for Mental Health. There are care managers that work with individuals with autism in the mental health side. They run parallel. I'd like to review a little bit about accessing these services. I'm not sure who's in the audience that needs some of this information, so I'm going to review it quite quickly. I know that there is a physician's assistant from the emergency room in one of the hospitals, so that's very exciting. I'm hoping that we're supporting you as well, and again, at the end of this, you're certainly welcome to ask us any questions or reach out back. But I think what's important to know is that pathways to accessing home and community-based services is long. It takes some time, but in the end, it's worth the journey. Usually it's a parent, someone in the circle of support, a teacher, a guardian, an educator, a behavior specialist, who will make a contact with a care coordination organization to get this process going. We transition typically through the schools, so oftentimes a guidance counselor will be that person that will make that referral. There's a long and detailed process to go through. It's Medicaid money, and we have to be accountable to the taxpayers for any dollar that we spend. So it's not difficult, but it does take a while. The front door, which is a very nice name for a meeting at the Office for Developmental Disabilities, where you would go and you would talk about your individual and you will learn how to process this long event. All right. In the PowerPoint we have, I've added in some of the real details of the process, but I think what's important to know is that the process is one that will deem your individual eligible. You have to be eligible to receive this service. Obviously, you can't just go in and say, well, I have a developmental disability, I have autism. You really do need to make sure that you have your paperwork in order. If you do not have paperwork that has a diagnosis on it of autism or any other diagnosis, they will be rejected. We need to prove that before the age of 22, your loved one has been diagnosed with the disability, in this case with autism. So I ask all parents and caregivers and educators to just make sure that we have that paperwork available when it's time to go and apply for this. Once your child is 18 years old, the adult he's become an adult, he is eligible for Medicaid on his own based on his income. But prior to that, it's the waiver. So despite the fact that a parent makes a very good living, the individual still will be eligible for a Medicaid waiver based solely on their disability. That's why we have to hold on to that paperwork. It gets submitted by the care coordination organization for you, and 30, 40 days later, I'm seeing a face, so maybe we can talk about that more.
It was a year.
It took you a year?
It was a year.
To get through Medicaid?
The whole process until.
Yes, the
until
whole
all of
process
the-
could
yeah.
take up to a year, depending on if we're doing it pre or post-pandemic as well. You were probably pre-pandemic, I'm guessing?
Yes,
Yeah.
yeah.
And the systems have changed over time and evolved, and so, yes, so just take it from Mom that it does take a while. So don't waste time starting if you're an individual who wants to get this going for your loved one. All right. We also have services for people with that come under the Office of Children's Health Home Care Management. That typically is another option for families. There are many options for families. You just got to figure out which one you want. Children's Health Home Care Management is a mental health based organization like adult mental health, behavioral health organizations. They work with children who have people who have children with mental health issues who may or may not have a developmental disability. They can have one, either or both. Again, it's another opportunity to access services. In Rockland County, we go through what's called the local government unit. If there's anyone on Zoom that is in Orange County, each county does have their own local government unit. That's a part of the Office for Mental Health, and the reason that they call them local government units is they represent the Office for Mental Health in each county. And that process is similar to the one we just talked about. Make sure you have your paperwork, make sure you have your diagnoses, and then once again, the process begins. I think that, I wanted to talk a little bit about advocacy, and again, people who work with individuals with autism, including first responders, are sometimes excellent advocates. Moms and dads and loved ones, they're always great advocates, and they really have to work hard. But there are other people in the community that serve our special needs cohorts that you wouldn't expect. That librarian, that police officer, that ambulance driver, or EMT, the behavioral health response team here in Rockland County, great advocates. When it's time to go to Albany, all of these people show up. And I would always encourage anybody who has any contact, any interest, to look into being an advocate for this group, because those of us who work in the field, we advocate all the time. But the politicians, the taxpayers, they want to hear from you. They're happy to hear from us, but they'd rather hear from you. So don't be afraid to advocate. And advocate doesn't mean argue. Advocate means explain, talk, be persistent, and offer them an opportunity to understand what it is. Bring your loved one with you. Let them meet him or her. Let them get to see how great your son, daughter, husband, wife is. Why not? It's terrific. And it really, really works. So I have just, not on slides, but I do have 2 different contact resource lists that I have available to send to you. So if you're on Zoom and you want to give your contact information, put it up and I will email it to you. But one of the most important things that I think is important if you live in Rockland County, if you do not have this already, the Behavioral Health Response Team is offered to anybody in Rockland County, and they are a team of emergency medical technicians, EMTs, and adjunct social workers who work with them to go out on calls, to address a crisis, a behavioral health crisis. They're available 24/7. Their phone number is 845-517-4000. I'm sorry, it's 0400. I thought I knew that number by heart. It's 0400-517-0400. And again, this is on a document that I can send to you. Aside from BERT, that's what the Behavioral Health Response Team is called, there are other opportunities to get your questions answered, whether you be an EMT, a fireman, or a policeman, or a parent, loved one, or an interested party. And I think one of the things I'd love to advocate for is for you to reach out to our autism training team, this team that puts together these individual presentations to you. We are available to answer your questions. Throughout the year, there'll be several different opportunities for different topics. and any and all of us are available to be reached. If you have an individual question or you'd like some guidance in a direction to go, how do I get care management? I'm not sure I understood. I'm not sure what's on the PowerPoint. Ask. We're more than happy. We are here more than just, for an hour on an evening to present this to you. It would be wonderful to have that opportunity to talk more with you. If you're with a religious organization, whether it be a church, a synagogue, a mosque, we are also available, and there are experts within those groups of people who can address the questions that you may have that may or may not be religious based or culturally based. We have people who speak in many different languages. So I would really like to advocate, when we talk about advocacy, I would like to advocate for the services that are available to you. If you're not sure about BERT, give them a call. Ask them who they are. What do they do? When do they come? How do they do it? Don't be afraid to ask. They'll be very happy to answer that question for you. So with that, I am going to end my talk. You're a hard act to follow, Kristin. But I'm happy to answer any questions you have. I don't know if they're coming up on our Zoom, Matt, or no questions.
I have a question. I have a
Sure,
couple
Renee.
questions, actually. So coming at it from, I'm a parent, but coming at it from a first responder angle, if I were to request some training, like, okay, I'm responsible for putting together training for my firehouse or my ambulance corps, what are the resources, if any, that you would direct someone to
Excellent
create
question.
a plan?
Do you want to answer that, or do you want me to?
Sure. The easiest way would be to get a hold of us and try to give us the information or the contact person to reach out to, and we would schedule the training.
Okay.
We'd find the resource, or it would be, someone from Giovanni or other resources.
Okay.
Yeah, we have worked, I have worked with the emergency room staff at the Nyack Hospital, Montefiore Nyack, and at Good Samaritan Hospital to do some training for their ED staff years ago, Siobhan, before I don't think I met you. There's also mental health first aid. That's an option for them. So as John has said, if there's a particular group that you're aware of, or you want to just go and tell them about it, please let us know, and we can certainly find a way to direct them to the best place to go for whatever it is that they're needing.
Because, on the one slide, I believe, Kristin, it was in your presentation where you talked about how families can get their loved ones familiarized with some of the first responders, and that's great. But I also think about it and I said, well, if I'm one of those people, okay, I've met this one person, that's cool, I met that one person, nice kid, whatever. But if there's an opportunity for them to be more immersed with multiple people with autism, in a classroom setting, for example, because I think to see the real spectrum of how different the behaviors can be and what some of the effective management techniques might be. You can't just kind of stop in, say, hi, I'm Mr. Police Officer, and, give everybody a sticker, and yeah, that's great. That is great and valuable.
More than that you're
for them, and they're in the business of being observant and picking up on, very subtle cues. So it would seem to me that if they were given the opportunity to spend, a few hours, maybe a couple times a year, to kind of just refresh their memory and see what techniques work, that might be an effective thing. I don't know if something like that's available.
You know what, we could work on anything. We would try to put together whatever it is that someone asked. Can we always fulfill it? I don't know, but it's certainly worth a try. The police departments here in Rockland County are very responsive to Giovanni-O and to the other organizations that they support here in the county. I'm guessing that it's the same thing in Orange County. We have had some real good luck in the past. I haven't done it in a while, and maybe you have, going to the police departments, offering them these opportunities, and people actually taking us up on it. So I think, as much as we can sit here and talk about this, and we should, and these are wonderful ideas, and thank you for that, I think that we also need to advocate more in our communities. So, you know, it's on us as well to remember to go out to those people. So I don't know if there are EMTs or police or fire on here. If there are anybody that has anything that they need to say about that or are aware, I'm not sure. I can't tell.
Nobody's commenting.
No. Okay. All right. Is there anything else
That's
you'd like
it
to
so
offer?
far. I
Because
think
that's
that's it for now. Thank
That's
you.
terrific information. Thank you. It's always good to hear from persons who have lived experience because it helps us get better at what we do and what we try to do. I'm going to reintroduce John.
Thank you, Jane.
You're welcome.
Just want to say thank you all for joining here in person, everyone else on the line. Thank you to our presenters, Kristin and Jane. As to your point about the trainings for different first responders, like I said before, any police department, fire department, ambulance corps that is interested, or paramedics that are interested in any kind of training on autism or anything else that they'd be interested in that we could help with, they could definitely reach out to us. And once again, they can reach out to me. I'll be able to schedule or at least find a resource for them. Main number is 845-708-2000. My extension is 1234. And reach out and let us know how we can help.
Thank you.
And again, thank you all, and have a good day.